having some issues with kids getting shots and not liking it very much and become a little bit traumatized from it. And so we thought it would be a good thing to try out, and we've been very pleased with it so far. Well, we had tried a number of things. I mean, depends on their age and things. You would try to have some, reasoning, and you need to do this because it's really going to be helpful, and that works sometimes. But then if they're really young, it's just tough. I mean, they just, you're coming at them with a needle, and they don't want to get stuck, no matter how bad it is. So it could become really traumatic for them. And so through the years, we had tried various things. Some was Emla cream, which is a lidocaine cream, trying to allow that to numb it, the area up. And the problem with that was it took, you're supposed to leave it on 10 to 15 minutes, and it was of marginal benefit. We would try ice, just to cool area down, get it cold enough, and try to use the shot so it maybe numb the area a bit. Somewhat helpful, but not the easiest. And then I think the latest thing we had tried was freeze spray. And so just cooling the area down and doing that. Again, it was so-so. I mean, sometimes it would work, and then other times, no matter what we tried, they tended to fuss a lot. If it was a life-threatening condition, like we have quite a few young patients, and let's say they could be 2, 3, 4, and they have fire ant hypersensitivity, and that can be a life-threatening anaphylaxis event, and they really need to be on the shot. So we sometimes have to push through that, despite some of their fears and concerns. And so we really, in those particular group of patients, we were hoping we could find something that would allow them to get their shot and not be so worried about it. What was the best thing to me was, I started talking to the nurse. I said, "What do you think? What do you think? Is it working?" He said, "Yeah, it is. I mean, most of the kids seem to, they don't complain as much about it. It seems to work pretty good." So we started immediately seeing some pretty good success. And being the conservative top end, I just had ordered one because they said, "Oh, I don't want to have this thing and it not work." And so then the nurses said, "Hey, this thing's working good. Are you ready to order another?" I said, "Yeah, it's working. Let's get another one." So we've been very pleased with it. I think for us, it's a good investment. It makes it less traumatic for the patients and less traumatic for the parents. And, we get them to be able to accept a form of therapy that in some cases is life-sustaining, especially when they got like this fire ant trouble. So it didn't seem like they had too much trouble with it. They seemed to maneuver well with using it. And again, I was a little concerned, if you had the device and trying to give the shot, and we kind of talked about that, but I think they have come up, where they feel very comfortable with it. I've had not any negative feedback as far as it's been hard, or, we have a hard time giving the shot, or the kids are moving and stuff. So I think it was an easy device to use. If you got kids that you're, administering immunotherapy, particularly young ones that, for whatever the case may be, like in our situation with fire ant hypersensitivity, it has worked very well. Nurses have been pleased with it, and again, I'm very pleased that we don't hear all of the crying and and again, sometimes it's very traumatic, and I don't want to do anything that would be a negative impact on that child later on in life just because of I don't want to be fearful of allergists when it's an adult or something. So we've been very happy.